Sometimes the biggest reason why your agency is not getting referrals is because of you. And if it's not you, it's your owners, it's your managers, it's your nurses, it's the people in the office, it's your home health aides, it's that person who actually picked up the phone today. Those may be the reason why your agency is not getting referrals. This is exactly why companies like mine help agencies like yours so that we can actually train you guys from top to bottom, from bottom to top, from left to right, from pretty much anywhere, anterior to posterior, whatever you want to say. That is our job. That is what we're here for. Because sometimes you may have the best marketers, but if your support staff, your support team is not delivering, not putting themselves forward, not putting themselves in a position to make sure that your company is looking good, that is probably why you are not getting referrals. One of the best things to do is this. You need to do a self-assessment. You need to look at yourself, at your company. And we actually have a service over here at Home Health Success Academy where we actually do what we call Secret Shopper, where we will actually go to your company or call your company and see how their process is, to see if they're answering the phones correctly, if they actually know how to answer some particular questions. The question to ask is this: why do we do this? Why do you want to do this and follow up on your own team, on your other services, on your, not just your marketers or liaisons that should be followed, but at the same time as the other support staff should be followed as well? Why do we have to do this? Let me put it this way. You'll be surprised how many agencies I know have lost referral sources just because their receptionist does not answer the phone correctly. And to be honest, some of the biggest people that commits these problems, that actually commits the mistake of not answering the phone correctly, where they answer it the wrong way, are sometimes the managers, the nurses themselves as well. Don't pick up the call and say, hello, or what's up? Or don't pick up the call and say, yeah. Or don't pick up the call and just say hello, right? When you pick up that phone call, if somebody's calling, whoever's calling, you need to make sure that whoever calls you can be a potential referral source. And if you answer those phones improperly, they may not refer to you again. Or they may look at you as incompetent. They may look at you, or they may just actually hang up the phone. And if you actually don't follow up with these referral sources, you'll never know why they stopped calling you. So make sure that you look into the mirror and you self-assess yourself or your company and see if your support staff is being able to answer the calls correctly. You want to be able to look at you need to be able to look at what your strengths and weaknesses are. Have a group meeting. Tell everyone that this is an open book, that no one's going to get in trouble, that they should share what they feel are your weaknesses are, your company's weaknesses. Everyone's going to want to talk about the strengths, and those are great, but the best question is this, is where do we need to improve ourselves? What is our weakness? Because once you know what your weakness is, you need to be able to target that and fix it. If you have bad phone skills, if you guys have uneducated staff, or they're not educated fully, or they need to be able to be provided more information about what services you provide. Look, find your strengths and weaknesses, but most importantly, know your weaknesses. The next thing is this. Let me ask you this. Have you ever refused a particular patient before? Somebody referred a patient and you tell them, we can't take them. Well, guess what? By you refusing that patient, you are costing yourself money in the future. Now, I'm not saying take all the bad patients out there. You want to be able to service patients that you really can serve, okay? And you don't want to be able to be taking big losses constantly, okay? But what you need to know is this. Sometimes these physicians, these referral sources are literally just trying you out. And if you can prove yourself that you can take care of those hard patients, then guess what? Most likely they will be the one that's going to be calling you all the time. because if they know that you can take care of the hard patients, then they know you can take good care and great care of those patients that are not hard at all.